Welcome everyone. Well, this is part 4 of 5 when we're talking about the CMS conditions of participation for hospitals. We're again on part 4 of 5, and you can see on slide number 1 that I've broken it down into additional sections. Today we're talking on quality assurance performance improvement, medical staff, radiology, laboratory, dietary utilization review, emergency preparedness, and facility services. Now some of these things changed in 2019, 2020, and 2021. And so we're giving you the most up-to-date information that we do have. I'm going to start talking about QAPI, again, Quality Assurance Performance Improvement. Every hospital has to do this. We used to call it just PI. Now they've added on QA. They made some changes through the Hospital Improvement Rule back in 2019. Well, they'd also put out what's called a QAPI memo. Now this started back in 2013. You're also required, as I mentioned, to track your adverse events. And what we're finding, and what the report actually found, was nurses, other healthcare providers, they were not reporting adverse events. So we did talk some on the QAPI standards, but I'm going to go ahead and go through those now. It starts at tag 263. Let's switch over to some executive responsibilities. So as I mentioned on adequate resources, you have enough bodies so people can go to meetings and their duties are covered. I talked about the Unified Integrated Program. Again, this is new. So QAPI for Appendix A, they made fast changes. I'm sorry, for Appendix A, they made minimal changes. For critical access hospitals, they made the vast changes. Well, this section then talks about telemedicine. And we all know during the pandemic, that thing took on a whole life of itself. So how does this work? Now, there are some specifics here. Well, I combined a couple here under the medical staff bylaws. These are very short tag numbers. Privileges, as I mentioned, could be active, courtesy, referring, or consulting. The bylaws have to describe how your organization structure is set up. As far as the history and physical, there were some changes made. So this is what the policy must include, and this is new, tag 362. Now I'm going to move over to some of the more focused types of services within a hospital. And I'm going to start off with radiology. Generally, for radiology, FDA, they also talked about changes in safety precautions. Therapeutic radiology. You have to make sure, of course, safety precautions against hazards. You have to do periodic inspection of your equipment. Just like any piece of clinical equipment, we have to do it periodically. And of course, we have worker safety. Other provisions, you have to have an order. Your records, they must be maintained for all procedures that you perform. All right, let's go ahead and talk lab. Again, these are some of the shorter portions of the manual, but quite a bit to do with clinical services. As with radiology, you must have adequate lab services to meet the needs of the patient. Adequacy of services. Joint Commission has a few more requirements. Emergency lab. These are the services that are available. Written description must be provided and available to the medical staff. Tissues. You have to make provision so that not only do you get it, in other words, proper receipt. Let's talk about the lookback program. Keep documents, the source, and disposition of all units for 10 years. You must have 3 things in your notice. Then the look back. This is related to only new blood and safety issues identified after August 24, 2007. All right, let's talk dietary. So now, these changes, hospital, otherwise, you have to have an organized dietary service. It must be directed and staffed by enough personnel. As far as your organization, there are 7 dietary policies that are required in the conditions of participation. There are 5 policies then also that the director must develop. The dietitian, again, different than the director. You didn't realize dietary took up so much of the manual, but it really is very heavily involved. Therapeutic diet, if they're going to refuse foods, then we got to look at substitutes that are equal nutritional value. Diets, they have to be based on the assessment of the patient's needs, whether it's both nutritional and therapeutic, and documented in the record. You have to have a current therapeutic diet manual. All right, let's switch over to something different. This is more broad. It's supposed to focus patient care like lab, radiology, and diet. This is more broad. This is utilization review, and it talks about services provided to Medicare and Medicaid patients. Now, there are 2 exceptions when you do not need a utilization review plan. You do not need. You're still going to have one, but you don't need one. As far as your committee, you must have 2 or more practitioners to carry out the functions. There are limitations to your committee. The decision on admission or continued stay. For extended stay review, the Notice Act law, the MOON form. It's the Medicare outpatient observation notice, also known as the MOON. There are several documents. Don't forget your non-English speaking patients. There's one in PDF and one in Word. All right, we're getting near the end here, so let's talk about physical environment maintenance. So maintenance and hospital departments who are responsible for the buildings and equipment have to be included in QAPI. They must be. They have to comply with all the requirements. The physical plant, the building, and overall hospital has to be developed and maintained so it's safe for the patients. Look at your age-related features. You must have adequate security. So things and areas you want to think about. And if you've ever listened to any programs on ligature safety, same thing with ligature. Preventing that inpatient suicide, creating that safe environment. If you have any unmitigated risk in your psych hospital or dedicated unit, that rises to the level of immediate jeopardy. You have to address weather-related issues, power lighting. You have to have a procedure to get your trash on a routine basis, and that includes biohazard. Now, there were additional life safety requirements. Sprinkler system. Every sleeping room, you have to have an outside window or door. You must follow the Healthcare Safety Facility Code. Again, you have to keep your facilities designated and designed and maintained according to your laws. For diagnostic therapeutic facilities, they have to make sure they're located for the safety of the patient. There must be proper ventilation, light, and temperature in all areas. That includes pharmacy and food. So I'm going to wrap it up by emergency preparedness. All the emergency preparedness went to Appendix Z. From that assessment, you develop your plan. Keep in mind security of your patients and supplies. When that hospital evacuated, you have to have policies and procedures to track any on-duty patients and staff who have sheltered, and also how do you track those patients who are transferred. So that concludes it. Thank you for those, yes, who did. That's correct. Yes, it is the sensor alarms. That was definitely the one. And just in the interest of time, I don't see any questions at this time, so I'm going to go ahead and conclude. Again, thank you everyone for participating, hanging in there, and listening. Again, reach out to CMS if you have a specific question. They're the best folks to answer those for you. So thank you and stay safe.